I decided at a fairly early age that I wanted to go to medical school, and then in high school I had an athletic injury to my knee, ended up having surgery when I was 17, and that had a big influence on my decision. I went to college at Georgia Southwestern College and was accepted into medical school at the Medical College of Georgia and was there from 82 to 86 and began practice here in Macon at Forsyth Street in August of 1993. I think our people are the strength of our practice. We try to treat every patient as an individual patient, and I work with ages from babies up till our elderly population. Young people come in usually with injuries, whether they be from sports or just from playing on the playground. And then we also treat the 80 and 90-year-old patients with arthritis of whatever joint may be involved. My main area of expertise is in joint replacement and in athletic injuries. For the older patients, unless they have an obvious tear in their rotator cuff, we either inject those with some cortisone, which will help tremendously with pain and swelling, or we can add physical therapy if it's appropriate. The physical therapy usually is done at our physical therapy center here at Forsyth Street. I've seen a lot of changes since 1993. I like to tell patients that it's like models of cars. You know, the model that's coming out this year is still going to have 4 wheels and a steering wheel and 2 doors, but it's a little sleeker and a little more modern. MRI is a test that we use to image different parts of the body. It gives us information about smaller structures and what we call soft tissue structures that we cannot image on a plain x-ray. I've had cases where particularly older people came in a wheelchair, and a lot of times they'll have arthritis in either their hips or their knees and not come in for treatment until they literally couldn't walk anymore. And sometimes you can actually go in surgically, replace whatever joint or joints might be giving them trouble, and yes, they can ambulate again. Our surgery center allows us to do outpatient cases here close to the office at a convenience for the patient where we don't have to go up to the major hospital. A lot of the patients that come in do have associated medical problems along with their orthopedic complaint. High blood pressure, diabetes is certainly one that we see. So we have to look at the whole patient and really rely on the medical doctors to help us manage those patients with diabetes. We would like for our patients to know that they can use our office for emergent problems that might arise. We are making a distinct effort to have slots open for those type of complaints that we need to see on a more urgent basis.